Doc, Doc,
Yeah?
can you look at my granddaughter for me? She's hot. She's hot.
Come, Grandma. Let me take her temperature. Let's talk.
Hi, and welcome back to Pocketbook Pediatrics. I'm Dr. Rishalan Brown, and as usual, I'm always so happy to have you here with me today. So, hot. We're going to be talking about fever today, but not so much the why of fever, more the technical aspects, the what is a fever? How do I know that my child has a temperature? How do I take the temperature? When should I be concerned? Those types of questions we're going to answer today. Now, if we're to define a fever, we'd call it an abnormal increase in your temperature. But why does that happen? So all of us have a temperature regulator, a thermostat, if you will, in our bodies that keep our temperature at a normal level. Now, when something like a virus comes along, it can reset that thermostat to a higher level and lets our body think that that higher value is the normal. So our bodies begin to work hard to get to that higher temperature to become normal, and so we have a fever, and the temperature stays elevated while we have that illness, and then once we get better, the thermostat gets reset to what is actually normal and the fever goes away. But we still need to know, like, what are the numbers? How do I know when I actually have a fever? Because many of us have that experience where mommy would have come along and she said, boy, you look sick, and put her hand on your forehead and said, boy, you feel really hot, you have a fever. But that's not really an appropriate way to determine whether someone has a fever or not. We really need something to help us measure. So we use a thermometer. And there are many types of thermometers that are available to us today. And there are many ways that they can be used. So we have like a glass type thermometer, like this one we have here today. And many of us may remember these from when we were young. Our moms may have used these. But the important thing to note if you choose a glass type thermometer is that you should choose one that is mercury free. Those older ones have that toxin mercury in them that we wouldn't want to get in contact with your skin at all if it should break. And then we have digital thermometers like these. Most of us are used to this type that has this display like a watch. And it's pretty easy to use. But there are other digital thermometers as well, like the in-ear canal thermometer or the strip thermometer that's used on the forehead, or even those infrared thermometers that are being used commonly now because of not wanting to make any contact because of the pandemic. And then we have to think about the different places that thermometers can be used as well. So we can take the temperature in the mouth, we can take it under the arm, we can take it in the rectum or the bottom, we can take it in the air, and we can use the strip thermometer on the forehead. So how do you know which one is right for you to use? Well, that really depends a lot on the age of your child and their ability to tolerate how the temperature is taken. But before we say that, we must say any thermometer that comes in contact with your skin is going to be better than one that doesn't. So the infrared thermometer I would not suggest as your daily use thermometer at home. Of the other types, the temperature taken in the rectum is going to be, or the bottom is going to be the best type of temperature, the most accurate temperature that we can get. And the thermometers that can do that for us are these that we have here today. The other thermometers are fine as well, but we may need to correlate them later with a rectal temperature, especially if your child is looking very unwell or you go to seek further help at the pediatrician. So when we talk about now how to take the temperature, if your child is a newborn to 3 months old, a rectal temperature is fine. But if you're not very comfortable with doing it at this age, an armpit temperature is good as well, which these thermometers will do for you. An in-ear thermometer is not useful at this age. It's not a very accurate reading at all. When they're 3 months to 4 months, we really would like to get that rectal temperature if we can. But again, if you can't, an armpit temperature is fine. And again, if you can't get that armpit temperature, then we'd move on to either the forehead or in-ear. And then when they're 4 and older, they usually can tolerate keeping a thermometer in their mouth. But if they're shivering or they can't tolerate keeping it in their mouth, again, an armpit temperature is fine. And if not, an armpit temperature. Again, one of the other two methods is fine as well. But now you're going to say, okay, Dr. Brown, I know what I'm going to use, I know how I'm going to use it, but I still need to get down to the numbers and, well, the letters, quite frankly, because C and F, sometimes I'm confused, I'm not really sure. But not to worry, don't be confused. It's simple to understand. The C stands for Celsius, the F stands for Fahrenheit, and they're just different ways of recording the same thing. Let's look at it like money. There are many different types of currency: Jamaican dollars, US dollars, British pounds. We could go on. But when we talk about interchanging money, we talk about value. So when I have, let's say, $1 is equal to 100 Jamaican dollars. When I go to the store, they're both going to buy me the same thing. I'm not going to get more for one or less for the other. They're both going to buy me the same thing because they have an equal value. So it's the same thing with Celsius and Fahrenheit. What you need to know is just to choose one and stick with it. So how do we go on to talk about when you have a fever now? So first we have to know normal. So the average temperature of most people is 98.6 degrees Fahrenheit. And we'll move forward in Fahrenheit as we talk today, but I'll present both numbers for you so you can compare them. So we say average because it really is a range. Some people may be a little bit lower, some people a little bit higher, but most tend to fall at about 98.6. When we talk about having a fever, well, if there's anything that you've learned from me, it is that it depends. It depends on where the temperature is taken. So if you have a rectal temperature, forehead temperature, or in-ear temperature of greater than 100.4 degrees Fahrenheit, that's a fever. If you take an oral or mouth temperature and it's greater than 100 degrees Fahrenheit, that's a fever. And if you take an armpit temperature and it's greater than 99 degrees Fahrenheit, that's a fever. But we have to be careful here as well because we have to talk about things like bundling. So your little ones that you still wrap in receivers, we have to make sure that we get them unbundled because sometimes just being wrapped up in the receiver can increase the temperature, but it's not really a fever. So we have to make sure that they're unwrapped for at least 20 minutes. And then our bigger ones who are more active or who maybe just had something to eat or drink that was hot and cold, we have to make sure that they rest and they cool down for at least 20 minutes, or that they haven't had anything to eat or drink that's hot or cold for at least 20 minutes before we take that temperature, so we know we're getting an accurate temperature. Now, when are we to be concerned? Because really, fever, like a cough, is not the problem. It's the sign that there's a problem. And so we need to get down to what is actually causing the problem. Now, most fevers are going to be caused by like a viral illness, just like cough. And usually these are going to get better without any intervention. So if it's a mild fever and your child is doing fine and not particularly bothered, you may not really need to treat the fever. But there are times that we do become concerned, and these are the things that we look out for. So we take into consideration your child's age, the duration of the fever, the other symptoms that they're having, and if they have any other illnesses on board. So if your child is a newborn to 3 months old and they have a rectal temperature of 100.4 degrees Fahrenheit or more for any duration, that is reason to seek medical attention. These little ones, they don't have the ability to fight off infections like we do, and sometimes the fever is the only sign that something is wrong. And so we need to really get in and check and make sure that things are okay. If they're a little bit older, we may have some room to wait. So if they're 3 months to about 3 years and they have a rectal temperature of 100.4 or more, we don't really say there's need to assess until it's happening for more than 3 days. Then we say maybe we should check and make sure things are okay. And then if they're 3 to 4, that temperature goes up a little bit to if they have a temperature of 102 Fahrenheit or more for greater than 3 days, then we suggest that you get it assessed. And then if your child is having a fever for 5 days or longer of any degree, then we suggest that you get them checked as well. If at any age they have an armpit temperature of greater than 103 degrees Fahrenheit, they should be assessed as well. And if at any age they have a temperature anywhere on the body of 104 degrees Fahrenheit or more, they should be assessed as well. A fever that comes with a new rash, also needs to be assessed, because there can be some detrimental illnesses that are associated with fever and rash. And then we also think about special populations. So if your child has another illness on board that's long-standing, like heart disease or sickle cell disease or cancer or some autoimmune disease like lupus, these are not children that we watch for a long time with a fever. Definitely get them assessed, especially if they're looking very sick. They're vulnerable. They're not able to tolerate being sick for very long. So when do we start to treat? Well, if it's a mild fever, as we said, and your child is pretty much up and about and okay, there may not be need for any intervention with medication. You may just need to keep them very well hydrated and encourage that they have rest. But if they fall into any of those categories we spoke about before, and there's concern, or your child is just uncomfortable and you want to add some medication to bring the fever down, we usually start with something like acetaminophen. That's going to be your Panadol, your Cetamol, your Tylenol. Or if that's not giving you good effect, you could try ibuprofen, which is your Motrin or your Advil. Remember though that these medications do take some time to actually begin their work. So before you add another dose or add another medication, be sure to give it time, and also be sure to check with your pediatrician that you're giving the right dosages for weight and age, and giving them at the right frequencies as well. And then we also need to talk about other interventions like tepid sponging and using fan therapy, what we used to call sousing the baby down, or making the environment cool. Now, these things we used to suggest before as standard recommendations, but we've actually found now that they don't really make much of a difference in getting the fever down. So we don't necessarily recommend that those things be done. And I can't leave out the topic of fever and teething. No, I can't discount the many experiences that my moms and dads have had, but I also can't discount that there's no evidence to suggest that teething causes fever. What is more likely is that children who are teething tend to be in the age group of children who also get a lot of viral illnesses that cause fever. That's when they start going out to daycare, or when they start to go to preschool, and they interact with other children and pass around the viral illnesses that they have. So it's more likely that while your child is teething, they may have a viral illness that's on board. But if your child has fever while they're teething and you just can't see any other signs of illness going on with them, then be sure to let your pediatrician know at least, or take them in for an assessment to make sure that there's nothing else that's happening that we're probably missing that might actually need some intervention. So that's all for Pocketbook Pediatrics today. I hope the next time that you have a febrile illness for your child, you feel more prepared to handle it and really get the right numbers and the right intervention going. Thank you so much for joining me today. It's been a pleasure to be with you, and I look forward to seeing you the next time on Pocketbook Pediatrics. God bless.